All right, welcome. I'm so glad you're here. So, I grew up being a soccer player all through high school and then played in a rec league through college and later into my 20s. Also was a semi-professional dancer, and I've always been really interested in modalities that specifically focus on athletes. So I've done the on-base training, the racket fit training, I've done ART, a lot of these specific chiropractic modalities that are focused on athletes. And one of the favorite modalities that I've learned is Selective Functional Movement Assessment. So this presentation is all about SFMA, how I use it in my practice, how I think it can help athletes. And so we're going to jump right in. So as you can see, every athlete moves, not every athlete moves well. So movement. Movement is based on so many different factors. It can be based on how we're born. If you have scoliosis, you're going to move different than somebody who doesn't. It can be based on previous injury. It can be based on having surgeries. It's often based on coaching. How we move really depends on the coaching that we're getting. And as a chiropractor, I'm often working alongside coaches because some things require that. So I have a very kind of small niche within the treatment of different injuries or helping athletes. And the coach really is, driving the show. It can also be based on motor control, which we're going to talk a lot about because that's really the essence of the SFMA. So jumping in, how does an athlete identify altered motor control? So basically, we have inputs into the system. Most of these come from different receptors in the body, Golgi tendon organs, muscle spindles. You don't have to remember any of those, but we have all of these inputs and they go, and then they're processed into the brain. And then we have an output, and the output is movement. And so it's really hard to assess those inputs. It's really hard to assess what is going on in terms of the Golgi tendon organs and the receptors. And then it's really hard to assess what's going on in the brain. But it is not, we can assess the output. And so that's really the essence of SFMA, is creating a system where the output can be assessed so that we can identify if there is an altered motor control pattern. And the reason that's important is because if there is an altered movement pattern, it's highly likely that there's some sort of pain, not always. That's really what we're looking for with SFMA, is situations where there is no pain, but there is an altered motor pattern. And it can also lead to injury if there is an altered motor pattern. Some athletes have an altered motor pattern that's very unique to them and doesn't cause injury, but many have this altered motor pattern, and it needs to be remedied either with coaching or, with chiropractic interventions. So how do we figure out if there's an altered motor pattern? Well, many different types of medicine have different screenings that they do. So, there's a screening to prevent heart disease. There's a screening to prevent tooth decay. There's a screening to look at vision loss. Many medical professionals have kind of developed these different screening modalities in order to figure out, what's going on with somebody. There is nothing like that in the movement world, in the neuromusculoskeletal world. Well, there is something like that. There's the SFMA, and so that's what we're going to talk about. So, is there a screen to prevent muscle and joint injuries? What signs do we look for before symptoms of pain show up? So the creators of SFMA They, looked at all the latest research. They looked at the athlete populations that they were working with, and they were able to come up with a screening, basically, that could be used to determine if there was a likelihood of joint injuries that might be showing up because of altered movement patterns. And so this creation of this has really helped in terms of screening athletes and figuring out if there are limitations in their movement patterns, if there's an altered movement pattern, in order to minimize injury and minimize pain. So for most chiropractors, most PTs, most individuals, the first indication that there is a problem is pain. And pain is kind of an alarm bell. It's an alarm system that's turned on in the body. But what if we could identify a problem before pain? That's really kind of the essence of what we're looking at here, is we're trying to figure out the likelihood of pain arising before it actually arises, so that we can do something about it. Because once the pain shows up, then it changes the inputs and it changes the receptors, and it makes it more likely that pain in that area is going to show up again. So we want to try and avoid that. So that's the whole essence of the SFMA, is finding a better way, finding a way that we can identify problems, we can identify altered motor control, we can identify altered movement patterns prior to pain. So, if you go to your chiropractor, your physical therapist, your medical doctor, they're often going to give you a medical diagnosis. They're going to do the orthopedic tests and neurological tests. They might do some imaging, and they're going to come up with a medical diagnosis. So the SFMA is very different than a medical diagnosis. The medical diagnosis has its place, especially if there is a severe injury. It's really important to have that medical diagnosis. But the movement diagnosis is different. The movement diagnosis is basically looking at how the person moves. And based on how they move, we can determine, how they function, and we can oftentimes even determine how good they are at their sport. The people who move better are usually better at their sport. And so again, with coaching or with, chiropractic interventions, we can improve the movement patterns. And by improving the movement patterns, then the person can get better at their sport. And we can also work towards minimizing or preventing injuries by optimizing these movement patterns. So we're calling this movement diagnosis as opposed to a medical diagnosis. So it's a very different diagnosis. And this is really the essence of functional movement, and to some extent functional medicine, is that you're looking at the function, you're looking at the output of something, and looking at the function of it, whereas medical diagnosis is really looking at the end stage disease. They're looking at it once there's pain, once there's a problem. And so we're really trying to look at things upstream so that we can prevent problems before they start. So that is really the essence of the SFMA. The system allows us to discover the cause of dysfunction versus just treating the source of their pain. So this is something that I see time and time again. People will point to the source of their pain, or what they think the source of their pain is, or where they think the source of their pain is. But oftentimes there will be a referral from another area of the body. And medicine in general has become so specialized that if you go in to a medical doctor with a shoulder injury, all they're going to look at is your shoulder. They might look at your neck, but they're not going to look at anything else really, because they're going to think that it's coming right from there. Well, the beauty of the SFMA is that we're looking at all the movement patterns, and we're really not focused that much on pain. We're focused on the functional movement. And by being focused on the functional movement, if we improve the movement, and that can look a few different ways, which I'll go into. That improvement will often then lend itself to basically a reduction of pain or a reduction of the problem. And so we're focusing more on the cause than on the source. So one of the beautiful things about the SFMA is that it doesn't really take that long to do. You only need 7 movements to look at to be able to determine everything that you really need to know. And so, we can look at these 7 movements, and depending on how people do with these 7 movements, that gives us all the information we need to know. So that is so powerful. Also, we can then reassess these 7 movements. So we'll apply some sort of intervention, whether it's, additional coaching, whether it's rehab training, whether it's adjustments or massage, and then we can reassess those 7 movements and see if they improved. And if they did, we know we're on the right track, and we can just keep going down that track as we improve those movements. So the fact that this is so streamlined and that we really only need to look at 7 movements is pretty incredible, in my opinion. So this was created by Yanda. He was a physician and physical therapist, and he basically created this system of looking at the body called regional interdependence. And it basically states that the body is an alternating pattern of stable segments connected by mobile joints. If this pattern is altered, dysfunction and compensation will occur. So really what we're looking at in the SFMA, and the beauty of the SFMA is looking for these patterns of mobility and stability. And so the 7 movements then will assess different regions of the body and assess if there is a correct amount of stability and mobility in the body. And you can see it's kind of an alternating pattern, which I'll go into soon. So I'm going to give you a glimpse into my world here a little bit, and as we look at the SFMA. So Selective Functional Movement Assessment uses a repeatable logic to determine where the pattern is altered. So as I mentioned before, we've got these 7 different movements that we go through here. And then what I'm looking for is the movement functional, not painful? Is it functional and painful? Is it dysfunctional and painful? Or is it dysfunctional and non-painful? And as you can see, each of these different movements, one is red, and a couple of them are yellow, and one is green. So that tells me if there's additional assessment that needs to be used. So we call this additional assessment a breakout. So I have a breakout here. We can see this is color coded as well. So anytime it's green, that means you want to continue doing the breakout. So that usually means that it's dysfunctional, not painful. And then we would kind of continue going through the breakout. So if it's functional, not painful, then we stop right there. It's fine. They pass. No big deal. If it's functional, painful, dysfunctional, painful, it's usually we proceed with caution. If there's pain, we don't want to aggravate the pain. But if there's dysfunctional, non-painful, that's green light. That means we want to keep continuing into the breakout and going deeper and figuring out why that particular movement pattern isn't working and what is compromised in that movement pattern. And then that gives us the information that we need in order to figure out what intervention is going to be the best intervention for that person. So really the essence of SFMA is maintaining the mobility and stability of specific joints. So if a joint is supposed to be mobile, we want to maintain that. If the joint is supposed to be stable, we want to maintain that as well. This refers to the concept that seemingly unrelated impairments in a remote anatomical region may contribute to or be associated with the patient's primary complaint. So the beauty of the movement assessment is that we may do the movement assessment and find that there's really poor movement in the elbow. In the elbow, we want stability. So let's say there's not stability in the elbow, but they have pain in their shoulder. And then we find that when we increase the stability of the elbow, then the pain in the shoulder goes away. So they don't seem related because there's no pain in the elbow, but by actually working on the elbow, the pain in the shoulder goes away. So this alternating pattern is in the cervical spine, we want stability. The thoracic spine, we want mobility. The lumbar spine, we want stability. The hip, we want mobility. The knee, we want stability. And the ankle, we want mobility. When I do this, I differentiate things a little bit more here, but that's the basic gist that we're looking at. So the screen will tell you what each joint needs. So this is getting in a little bit into the weeds, but this is basically what I'm looking for. So I'm looking to see if mobility is needed or if stability is needed. And so I'm following that repeatable logic. And so you haven't done the screen, but just so you know, we're doing active movement and passive movement. So if active range of motion is limited, then perform passive range of motion. If the movement is still limited, then they need increased mobility. So that basically means that they're limited in both active and passive range of motion. And so the challenge is mobility, so we need to increase the mobility, assuming we're working on a joint that's supposed to be mobile. So stability. If active range of motion is limited, then perform passive range of motion. If the movement is no longer limited, so if they have the passive range of motion but they don't have the active range of motion, then they need to increase stability in the form of motor control training. And so motor control training often is what physical therapists do, what rehab professionals do. It's also, what a lot of coaches do, athletic trainers do. So if we find that there isn't stability, if we find that the active range of motion is limited, but the passive range of motion is not limited, then we can increase that stability through that different type of training. So my particular approach, and this fits right into the SFMA, is what I call reset, reinforce, and retrain. So reset often involves increasing mobility, and that's primarily what I do in terms of chiropractic adjustments, trigger point therapy, massage, ART, some of the things that I mentioned previously. And whenever you're able to break the pattern of pain, you're able to simultaneously increase mobility. If you don't, oftentimes our mobility is compromised because there's pain. And then also improving the movement of the joint with all of these different modalities. Many of these modalities also reduce inflammation in the muscles, and it helps improve circulation in the area where we're needing more attention. So that's kind of the initial focus here is resetting, and then we want to reinforce that. So SFMA doesn't deal with that a whole lot, but we're looking at spinal hygiene, so posture at work, lifting, posture in general. We're looking at improving sleep, managing stress. All of those inputs just reinforce a healthier pattern. And then we're retraining. So we're increasing the stability, primarily is what retraining is all about, which I talked about with the different professionals that focus on stability training. And so the repeatable logic of the SFMA allows us to identify whether we need to increase mobility and whether or not we need to increase stability. And then that gives us the guidelines and how we can best help the person. and what they're going through. So, one of the creators of SFMA's favorite thing to say is don't guess, assess. So, when somebody comes in, they're an athlete, they're not performing as well as they would like to perform. We want to create some sort of assessment that they can do to figure out why that's the case. And so many people, just guess. They don't actually have an assessment. They don't actually know what's wrong, what the problem is. And so by doing SFMA, we have some data, we have some objective evidence that shows, why they're able to move the way that they're able to move, and then we can improve that movement. So, of course, the reason I'm doing this whole presentation is because I think that the SFMA is really vital for all athletes, but especially as you kind of rise up the ranks and become a better and better athlete. And so, I would recommend definitely screening your athletes like we looked at with the vision screening and the dental screening. It's really good to have some sort of movement screening that you're putting your athletes through, as part of their physical exam, basically, their pre-performance screening, to, figure out if they're moving the way that they should. And if they're not moving the way that they should, figuring out if it's a mobility problem or a stability problem, and then determining what interventions are going to be the most effective for them. And ultimately, this is going to find the true cause of the problem, especially in those athletes that continue re-injuring the same area of their body. Those are the ones that I see usually have, some sort of movement deficit, some sort of altered movement pattern that I can help with, or working alongside the coaches, some improvements can be made there. So I talked to you a little bit about myself, but I love working with athletes, especially, middle school, high school athletes. I feel like those are populations that are usually really not focused on that much, or not focused on as much as they could, and that really is setting them up for the rest of their life. So doing a screening like this can really help them determine what areas of their body need specific attention, and then I can give them, a really streamlined plan on how to improve mobility or stability. So if you need help, I would love to help you. So if you need help with the physical limitations that you find in your athletes, I would love to help. I speak your language. I specialize in human movement, treating athletes, analyzing biomechanics, manual therapy, and therapeutic exercise. So so that's really the whole reason for this, is so that you get a chance to get to know me a little bit better, and some of the work that I love to do. And if you are an athlete or are a coach and you want more information about this, don't hesitate to reach out. I would love to, I'd love to help in any way that I can.